Hi, everyone. So glad to have you with us today. We are really excited about the topic we're talking about this afternoon, and I think it's going to be really applicable to a lot of you out there. My name is Megan Collier from the Texas Tech University Health Sciences Center Marketing Communications team. I'm joined today by David Trotter, a licensed clinical psychologist, associate professor for the Department of Medical Education, and the executive director for Texas Tech University Student Health Services. Hi there, sir. How are you?
Good. How are you doing?
Doing well. So excited to be with you today. You are a hot commodity right now. Lots of people have questions about different mental health situations happening across the country. But before we get into that, I want to talk a little bit about you. Can you kind of give us a little bit of background?
Sure. Yeah. So, like you said, I'm a licensed psychologist. I'm faculty in the Department of Family Medicine. I do a number of different things for the institution. I'm an educator, so I teach medical students and family medicine residents. I do educationally oriented research. I have a clinical practice, and I do some administrative stuff with some various clinics. So
What brought you to Texas Tech?
Really, the department did. I worked as a graduate student in family medicine and really fell in love with that department. And when an opportunity came available while I was on my postdoc, I jumped on it. And so I really came back for the people.
Wonderful. That's great. Lots of great people in West Texas, that's for sure.
Mm-hmm.
So, people are feeling a lot of added stress, a lot of anxiety during this time as they stay home, unsure of the future. What advice do you have for people who are feeling that right now and are in that space?
So it's a really good question. What I've been encouraging people is to kind of focus on 5 different things. The first one is to really work on fostering your kind of own hope about the situation and about the future. This is a stressful time. There's a lot going on that's unpredictable, but there's also a lot of good happening right now. And so I'm just really asking people, occasionally you need to stop and remind yourself, what do I have in my life that's really good right now? And what are the things that are most important to me? And to really focus on those things. I encourage people to find ways to help them feel calmer. This is a heightened stress kind of period of time, and so I don't know that anyone can be truly calm. But looking for ways to kind of bring down the kind of physical tension you feel. So doing things like, taking a walk, listening to music, reading, kind of whatever helps you to kind of lower your arousal levels, I think is something that's really helpful. I know the third thing is to help people focus on safety. There are obviously a lot of things that we can do right now to help us be objectively safer, right? Social distancing and not touching your face and washing your hands a lot. But there are some things that we can do that help us feel psychologically safer. And so the things that I'm really recommending are obviously limiting your media and social media exposure to COVID-19. We know that watching too much of this tends to make people pretty anxious. And so being careful with that and really focusing on facts and not the fear. I know there's been some great media campaigns around that, which I really love. The fourth thing is really focusing on connection. Social distancing is about physically being distant and not other kinds of connectedness. And so making sure that we're interacting with our loved ones, that we find ways to be close to one another. And you can do that virtually, or bust out a pen and paper and write a letter to someone. It's a good time for that. And then the fifth thing I focus on is really looking for ways to develop that kind of internal can-do attitude. I love West Texas. I think West Texans invented the can-do mentality. It's easy to get stuck in focusing on things we can't do right now, but there's a ton that we can do right now. There's the world is currently quite a bit different. And so it's time to get creative around the issues that we see and time to really focus on the things that we can do with our family, the things that we can do with our jobs, the things that we can do with kind of one another. So really developing that can-do attitude.
Those are all things that we can certainly do for sure. For those of us out there who might struggle with a specific mental illness, though, they are particularly vulnerable right now. And I think that we, as people who maybe don't suffer from that mental illness, can do something to help our friends and family along. But also there are things that those people who do struggle with mental illness can do themselves, right? Can you kind of take us through that?
Yeah, it's also a really good question. A good colleague of mine I heard recently say that, when things get chaotic, what we need to do is we need to go back to the basics. And I think that's really true for all of us, but I think especially true for people who are struggling with mental illness. And what I mean by sticking to the basics are making sure, if you're on a medication, that you're taking that medication as prescribed. Making sure that you go back and you look at those healthy coping strategies maybe you've had in the past, or healthy coping strategies that maybe a provider has taught you, and make sure you're really doing those things. Making sure that you're accessing care when you need it. Making sure that you're telling people when you need help. And also really making sure that you remain connected with others. Again, there's a lot of ways to stay connected, and this is a time where that is increasingly important if you're someone who's already struggling with mental illness.
And people who are supporting those with mental illness, we can continue to make those connections, right? Do those check-ins.
Absolutely, we need to be doing those check-ins. Call your family, call your friends. Have a conversation with your neighbor over the back fence, right? Mm-hmm. We can really be looking to find ways to reach out to those that we know may be struggling.
So for everybody, not just those that are struggling with mental illness, this is a challenging time because there's heightened levels of stress because kids are at home, because maybe spouses are spending a lot more time together in different routines than they're typically used to.
Yeah.
How can you kind of navigate that family dynamic, that new family dynamic, this new normal that we're all saying is going to be happening? We're going to have to kind of get used to it, right? How can we navigate that?
Yeah, it's a really good question, and certainly one we've struggled with in my family, given that we're all home all the time. Us too. We've been thinking a lot about this as a family, and what we have kind of been thinking of, and I think this makes sense also professionally, is this is time to really lean into those things that matter most to us, right? This is an unprecedented time. Hopefully, none of us lives through a time like this again, where we're kind of socially isolated in this way. But what this means is there are opportunities here that are really wonderful. Spending a lot of time with your kids, and when are we going to get to spend as much time with our kids as we do now, or our loved ones as the people we live with as we do now? So really lean into those things, especially those relationships that really matter to you, and embrace it. And at the same time, this is probably a good time to relax your standards in other ways, right? So if you're a person who has to have all the dishes done before you go to bed, maybe this is a time to kind of relax some of those standards, and the things that matter a little less, let's let those things go a little bit, and really lean into the things that matter at home, because hopefully this is the only time we'll have this opportunity. I think also what's really important is to make sure that you're getting time to recharge. We all recharge differently, and it's really critical that through all the scheduling of the day and managing school and managing work and all those sorts of things, that you're really intentionally putting time into recharge, whatever that looks like for you.
So did the dishes comment come from my husband, or was that just random?
No, it was my wife. It was my wife.
Okay, got it. So let's talk about now on the student front. You work with students very closely in your role. There's got to be some sadness, right? There's got to be some grief associated with losing these senior opportunities, these graduate opportunities, things like that. Any advice to both college students, but also maybe those seniors in high school who are looking at this, and it's a pretty stark slap in the face, right?
Yeah, this is a tough time, especially on our general academic campus. I'm the executive director of the student health clinic over there. And we've been seeing a lot of that, a lot of sadness, some grief over things that have been kind of lost, and some loneliness and fear. I think that's really natural. The advice that we've been giving them are really the same things that we talked about earlier, is focusing on those 5 things. And a lot of our undergraduates and a lot of our students at the HSC are West Texas natives. And so I'm kind of really trying to encourage them to adopt that kind of hardy spirit, right, that we have in this part of the country, and that can-do attitude, and really kind of focus on those things. For our students who are really struggling with mental health issues, because we have a large population of students who struggle with mental health issues, I'm really encouraging them seek professional help right now, and that help is available. Basically, all the mental health services we provide and the other various mental health clinics have all gone online, and so those services are really available.
I mean, I think that's an important thing. You know, we hear so much about telemedicine, but, you know, online counseling and things like this, that's a great resource for people out there.
Yeah, and we have not only online counseling, but we have a number of psychiatric providers who are running online, and so really we're at a point where we can provide full spectrum services to the students who need it.
That's really awesome. Anything else that we need to mention for students and families and just and folks out there as we kind of navigate this space?
Yeah, I mean, I think, you know, I've been trying to say this as much as possible. If you or someone you know is struggling with really serious symptoms or having thoughts about hurting themselves or hurting someone else, or even suicide, this is really a time to reach out. And again, there are resources available. You know, you can call the National Suicide Prevention Helpline. They even have a text line, and that's a great resource. And if things get really bad, I just encourage people, call 911, go to the ER, reach out for help, because there are people who are available and want to help.
Really, really great advice. Okay, so we'll end the seriousness on that note. And as we've been doing in all of these afternoon chats, we've been doing a lightning round just about you. Are you ready?
Yeah, as ready as I'll ever be.
Okay, the first one is sort of easy. It's the first one that I've been asking. Crunchy or smooth?
Oh, smooth.
Okay. Is there some sort of psychological aspect to that question that I haven't even been thinking about?
I don't know. I'll have to think about that. But peanut butter going through my head, and so
okay.
And I can't do crunchy peanut butter.
I know, me too. Okay, favorite ice cream?
Rocky Road.
That's the second one we've had in a row, actually. Okay,
Nice.
What show are you binge watching right now on whatever streaming provider?
Yeah, we're binge watching The Good Place.
Okay, that's a good one. Nice.
Yeah, we really loved that.
That's a good one. Last text message you sent. Can you share?
Can I look?
Sure.
I have to look. I don't know. I've sent so many recently.
We like honesty around here, right?
Yeah, no, it's, it was to a colleague of mine who, a psychologist friend of mine who I texted him asking whether or not he had heard of some new parity laws around providing mental health services over state lines. So it was, dude, give me a call, because I want to talk to him about that.
You give me a call. I like that. Okay, last question. What's the first concert you ever went to?
Oh, the first concert I ever went to was a Sister Hazel concert.
Yes. Yes, I love that. Champagne High, right?
Yeah.
Love that. Good one. That's a great one.
I think, oh my gosh, yeah. It's a long time ago.
That was a long time ago. Well, David, thank you so much for joining us this afternoon. Really, really important information. Take care.
Thank you. I appreciate the opportunity to talk to y'all.